The UK COVID-19 R rate has increased slightly this lunchtime, with coronavirus cases in England doubling every 7 to 8 days at the beginning of September.
Well, according to new data, COVID-19 cases are shown as no longer simply clustering in healthcare or care home settings. That was what we were seeing back in May and June.
Instead, experts say these new figures suggest the virus is now spread more widely in the community. Let's speak now to Ali Fortescue. And Ali, the rate rising above 1, quite worrying, and that is what is taken to decide whether we actually go back into lockdown, isn't it?
Yeah, that's right. And it is hard to calculate this R number directly, but the figures do suggest now that it is above 1. There is plenty of concerning reading, I'm afraid, this lunchtime, as you say, new data to suggest that the number of COVID cases at the start of September was doubling every 7 to 8 days. So if we look at where we were between the 22nd of August and the 7th of September, there were 13 COVID cases for every 10,000. If you compare that to the 24th of July and the 11th of August, where there were just 4 COVID cases for every 10,000. You can see the striking difference there. And this obviously, plays into the wider picture. We're seeing the number of COVID cases rising now. The Prime Minister putting the brakes on easing lockdown restrictions, now only allowing groups of 6 people to meet. So this all plays into that picture. But of course, the worry is what we have seen is the number rising, particularly among young people. The worry is what happens when we start to potentially see those young people passing the virus on to older generations, and that could be the point where we really start to see the number of hospitalisations and the numbers of deaths starting to rise significantly as well. And one last point, these news figures also suggest that there is now wider community transmission, so we're not seeing the cases clustering in a healthcare and social care setting. So that is also a real concern.
OK, Ali, thanks for that update.